Okay, good morning, good afternoon, and good evening, everyone, and welcome to April's ICHOM webinar. I'm glad you all found your way here. I know that there were a few technical issues with the Zoom link this morning. Today, we're going to dive into the implementation of patient-reported outcome measurement in maternity care and gain insight from the PROM PARTOS project. Our wonderful presenters today are from the Espases University Hospital in Spain, and they have implemented the ICHOM pregnancy and childbirth set and will be providing insights into their implementation, digitalization, and data collection. My name is Yasmine Saoud, and I will be moderating today's call. Throughout the session, we'd love to hear your thoughts and questions. You can access the chat by clicking on the speech bubble at the bottom of your screen. So to get the chat rolling, we'd love to know where you're joining us from today. So go ahead and put that in the chat. Feel free to enter your questions at any point in the session in the Q&A function at the bottom of your screen, and we'll sort of circle back to them in the Q&A session at the end of the discussion today. Before we start with our talk today, our annual conference, ICHOM 2026, will be held in Montreal, Canada, from the 7th to the 9th of December. This year's conference theme will be Value at Scale, AI, Outcomes, and the Future of Healthcare. Registration will actually be open from tomorrow, the 23rd of April, and you can scan the QR code over here to register and claim a 5% discount on tickets. Here you will find more than 700 international delegates from over 50 countries with backgrounds spanning from all areas in the healthcare system, as well as research and development. These include clinical providers, academics, government officials, and professionals from the medtech, pharma, and insurance, as well as, of course, those that are at the center of everything that we do here at ICHOM, patient representatives. At the conference, you will have the opportunity to attend site visits, workshops, simulation labs, and practical coaching sessions. You will also be able to network, take part in interactive discussions, and have candid conversations with global leaders. And you will hopefully leave having gained valuable insights in value-based healthcare, both on and off the main stage. Here is a sneak peek at some of the sessions featured in ICHOM 2026. I know Pitch Perfect was a very popular session last year, and it will be back this year, except we'll be leveling it up with the value-based healthcare pitch showdown. Moving on to ICHOM accreditation. This is a program that is aimed to certify implementers of ICHOM sets as they mature in the collection of patient-reported outcome measures. If interested, you can scan the QR code here, where you can find more information on this program. ICHOM accreditation offers global recognition as you transition to value-based care. We also have over here a few of the organizations that have been, who are ICHOM accredited so far. The webinar today will be focusing on the ICHOM pregnancy and childbirth set. If you'd like to learn more about this set, you can scan the QR code here as well. And this will take you to our webpage where you can find the flyer, the reference guide, and the data dictionary. These are all available for free on the website and provide the details of what the set includes and what you would need to implement as well. Now, without any further ado, I'd like to introduce our expert speakers today from the Espases University Hospital. We have Dr. Andrea Alegre García, who is an obstetrician and gynecologist. We have Dr. Luisa Alegre Latorre, who is the Director of Innovation and Projects. And we have a patient representative from the PROM PARTOS project, Luisa Espases Bennassar. So I will pass over to them so they can get us underway.
Okay, good afternoon. First of all, we would like to thank ICHOM for the opportunity to share our hospital PROM experience. And I especially like to thank Luisa Espases for being here, who is one of our PROM PARTOS patients that will be present today. I think in this class of webinars, international webinars, is pertinent to put our hospital on the map. Our hospital is based in the city of Palma, the capital of the Balearic Islands. The Balearic Islands are a group of Spanish islands in the Mediterranean Sea, located between mainland Spain and Italy. In relation with our hospital, we are a hospital complex made up of 3 hospitals that together provide the full range of specialized acute care services to the entire population of Balearic Island. We are a public hospital covered by the government of the Balearic Islands. The university's Faculty of Medicine is fully integrated within our hospital, and we also have a dedicated research and innovation institute. Our healthcare model is shaped by insularity. The smaller islands rely on the larger ones for healthcare services, and all of them ultimately depend on our hospital complex as the main referral center. We serve a reference population of over 1.2 million people. The complex includes 3 facilities: a psychiatric hospital, a medium state hospital, and an acute care hospital with 755 beds. In the acute care hospital alone, we have around 5,500 professionals, including 1,050 doctors. In this image shows the level of healthcare activity at our acute care hospital in 2025. To give you an idea of the scale, we carry out nearly 25,000 surgical procedures, over 500,000 outpatient visits, around 170,000 emergency department visits, supported 1,800 births, and recorded more than 30,000 hospital discharges. Healthcare demand increases a lot during the summer months, mainly due to the arrival of tourists and seasonal workers. Every year, more than 12 million tourists visit the Balearic Islands, and some of them turn to our hospital as their main point of care when medical attention is needed.
First of all, I would like to give some context in the maternity care. Maternity care is currently facing several important challenges. One of them is the over-intervention that sometimes we are facing, such as C-section or instrumental birth, that often can be not related with real benefit for the mother or the infant. At the same time, these interventions can have long-term consequences, not only physical, but also psychological and social, that extend well beyond the delivery room. And finally, healthcare systems are under pressure, both in terms of costs and workforce. So we are facing a situation where we are doing more, but not necessarily achieving better results. This situation has been described in the literature as a triple aim failure, where we see 3 things happening at the same time: poorer outcomes, worse patient experience, and higher costs. This highlights that focusing only on clinical activity is not enough, and that we need to rethink how we measure and deliver care. This is where value-based healthcare becomes relevant. Traditionally, maternity care has focused mainly on clinical outcomes. However, many aspects that matter to women are not routinely captured. We have long known that there is a gap in traditional care. We have been focusing on clinical metrics, not lived experience. Women's recovery and well-being go unmeasured, and patient priorities are rarely captured. That's why the value-based approach tries to go to the outcomes that matter to patients, not just the clinicians, try to align clinical decisions with individual needs, improve quality, not simply increase the activity, and optimize the resources and long-term sustainability. Value-based healthcare shifts the focus from what we do to what patients actually experience and value. And this was the starting point for our project.
Well, our PROM program started as part of the hospital's 28 to 2022 strategic plan. One of the key goals of this plan was to set up a system to measure not only clinical outcomes, but also outcomes reported directly by patients. The strategic plan created the right conditions to make this possible, both from a technological and business point of view. During this period, the hospital implemented an inversion of its EHR system, Oracle Millennium, formerly Cerner, now Oracle. I introduced Microsoft Power BI as a tool for data analysis and sharing. At the same time, the care model was reviewed, placing a stronger focus on the patient experience. Although the plan was delayed by almost 2 years as a result of the COVID-19 pandemic, this period was used to design and develop the technological infrastructure needed to support the PROM program. At the beginning, the hospital was part of a group of Spanish hospitals that wanted to start working with PROMs, sharing the strategic and business approaches they were putting in place. Over time, at some Espases hospital, we decided to take a step back and learn from the early adopters, such as Karolinska Hospital in Sweden or Kaiser Permanente USA and others. What we found was a clear common theme in their experience: the importance of developing PROMs through a patient-centered digital approach that is fully integrated into the EHR. Well, this is our model, our PROM model. Our model is built around 4 key principles, 4 fundamentals, which are already in place in the hospital. Firstly, we developed the USE PROM Tracker app. This app allows patients to complete questionnaires digitally in a personalized and user-friendly way. This app incorporates the logic of each process for each pathology, the times and the events that trigger different questionnaires. Events can be a hospital discharge, a surgical intervention, childbirth, a specific treatment, etc. Secondly, the app is fully integrated with our EHR. Patients are enrolled in the PROM program directly through the EHR, and their responses are uploaded directly in real time. Our clinicians don't have to change any tools to introduce the patients into the program. The third pillar is the use of the ICHOM standard, obviously, whether applied in full or adapted to the specific needs of our hospital. And finally, the fourth pillar is the analysis and use of the results. We do this through our Power BI analytics platform, which Dr. Alegre will show in more detail later. What is our level of integration? Integration with the electronic health record happens at several levels. First, as you can see in the image, whenever a clinician opens a patient record, the system clearly indicates whether the patient is enrolled in a PROM program. In addition, the information provided by the patient becomes available almost immediately, typically within 5 to 10 minutes after the patient completes the questionnaire through the app. In this image, integration into electronic health record 2, you can see that patient-reported information is accessed at the same level as other clinical data, such as vital signs, radiology images, or laboratory results. There are 2 main reasons for this. This is very important for us. First, it's simply more practical for healthcare professionals. And second, from a conceptual point of view. If we believe that patient perspective matters for clinical decision making, then this information should be available at the same level as the rest of the data clinicians work with every day. From there, clinicians can access all the information submitted by the patient in a structured and chronological way, including the responses to each question across the different questionnaires. This setup allows us to generate, for example, alerts based on patient responses, and importantly, because the data is structured, it enables much more reliable analysis and use of the information, something we go into more detail later too. And I think it's important to say our health system is currently looking at how to incorporate this information into the shared platform that brings together our clinician data and is used across hospital and primary care centers in our project.
Well, now I want to talk about the implementation of the project, the pregnancy and childbirth. For the implementation, we are following the standard phases of this type of projects. The first one was the preparation and configuration. This was the selection of the set, and in our case, it was clear that it was the pregnancy and childbirth one. Then we created the multidisciplinary team, bringing together doctors, nurses, managers, and IT experts. Then we do a gap analysis, and we compare the data that the ICHOM group wanted to collect and the data that was structured in our EHR. Then we do the definition of the workflows. It was the timelines of the questionnaires, if we were going to add more or not. Then we passed to the process and technology design. We choose the platform. The one that Luis talked about was the app, because we thought that our patients are young, are technological, and they can use the electronic devices. We then wanted to integrate all the information systems and for the questionnaires to be available at the EHR. We then did the questionnaire translation and conduct a pilot test on October 2022. The third phase was the implementation and data collection. We started training the staff on the importance of the project and how to enroll the patients. We started the active data collection and monitoring the results. Now we are between the third phase and the fourth phase, because from our point of view, there are two phases that can be transversal. You can go from one to another. And now we are also analyzing, giving feedback and improvement. We are working on the transparency of the data and also improvement the cycles. Here in a timeline, you can see that we started implementation at April 2022, where we had the first meetings. And 9 months later, we started the pilot with almost 50 patients. This phase took like 2 or 3 months because we had some issues with the integration of the systems and also with the iPhone devices. So from January, February of 2023, we started the data collection. We also do the training of the staff, continue active data solving problems. And by the end of 2023, we had 350 patients enrolled. By 2024, the end or September more or less, we had 750 patients. Here we had the first results because all the set it takes like 12 months for the patients to finish it. So we had the first very early results, and here we started implemented clinical-driven interventions. By 2025, we enforced the team for the enrollment, and we have 1,200 patients, and now we are almost 1,300. Well, as we have said, we use the full ICHOM standard, all the timeline milestone that the group says. We also have implemented one milestone more, and the translation process was by a professional translator. Here, I'd like to show you an example of how this setting is implemented within the app. To create the workflows, we use these mind maps, which show how the questionnaires are distributed along the timeline. Using this distribution, we were able to identify the turning points or clinical events that would serve as triggers for launching both prenatal and postnatal questionnaires. For example, to initiate the prenatal questionnaires, we created a clinical record entry as a trigger to start sending them out. And for the postpartum questionnaires, we used a birth form questionnaire as a trigger, which notifies the app that the baby is born, thereby initiating the delivery and the postpartum questionnaires. The project timeline is as it follows, based on the guidelines established by the ICHOM group. When the patients came for their first trimester ultrasound, if everything is normal, they are invited to participate on the project. They are provided with information about the project, along with the collection of PROMs data of the first trimester, assistance for downloading the app, and giving the username and the password. They also sign the consent forms to participate on the project and for the data protection. The remaining data collection points are the standard ones, but we also included the birth plan as an additional element at 32 weeks. This allows us to better understand patient expectations and preferences before delivery. And the PROMs are also collected at first trimester and at 42 days postpartum. This is some of the infography we provide to the patients. It's an information about what the project is about, the timeline, or the themes they are going to receive from the questionnaires. The app is also for free on Android and Apple Store. And I also wanted to show you that PROM Partos is not the only PROM that we have on the hospital. Now we are managing 16 PROMs at the hospital, with all of them almost 4,000 patients, being PROM Partos the largest one. Now, for our data analytics system, we use Microsoft Power BI. Here, you can see what our dashboard looks like on the PROM Partos main screen. In our case, we've decided to organize the data based on what it represents rather than by the timeline itself, which can be then selected within each section. Now here we present the data on two examples. On PROMIS Physical Health Scale, we wanted to show you how the results are displayed. At the top, you can see data on self-perceived task performance, and on the right, the fatigue. And at the bottom, you can see an overview of how PROMIS scale has evolved across the project's different timelines. Here, we can see on the third trimester that there is a lower punctuation than on the other milestones, and this can be reflected because of the women, a reflection because of the women. The belly is growing, the baby is growing faster also, they can feel heavy, can have some fatigue, and this is normal for this time of the pregnancy. Here we present also the data on the PROMIS Mental Health Scale to illustrate how the results are displayed. At the top, you can see data on self-perceived quality of life and mental health. And at the bottom, we can see an overview of how the PROMIS scale has evolved across the project's various timelines. As we can see, there is a slight decrease in mental health scores during the postpartum period. This reflects the challenges that many women experience after delivery, which are not always visible in routine care. We also wanted to show you how we collect data from the PROMs. These are the forms we fill out in each patient's medical record. Specifically, the first trimester form is completed by paper by the nurse responsible for the enrolling of the patients. This is the 42-day postpartum questionnaire. The structure is the same, but since this form is much longer, we looked for structured data in our medical records. Since we couldn't import that data automatically, we had it displayed in a separate window within the questionnaire itself to make this task easier for the clinicians. We also analyzed the participation rates. As expected, participation is generally high during pregnancy but decreases over time, especially in the postpartum period. In the first trimester, the rate is 64%, continuing in the third trimester with 48%, in the 42 days postpartum, 42%, and 34% at 6 months postpartum. We also analyzed the engagement rates, and in the first trimester it was 64%, continuing in the third trimester with a 63%, and in postpartum period the rates are 48% at 42 days postpartum and 58% at 6 months postpartum. We have done a good effort, a great effort here for the engagement of the patients. So the key value of the project is not only collecting data, but translating it into real changes in practice. We have identified the met patient needs through the PROMs. We have created a referral pathway to perinatal mental health for the women who need it. We are doing active follow-up of patients with incomplete questionnaires. We integrated the birth planning also in our electronic health record, and we adjust some questionnaires, sometimes in questionnaires. But how did we accomplish this? We are doing reminder calls, so we have a proactive contact with the patients to encourage questionnaire completion. We added the APDS on the prenatal part of the timeline to implement this two-stage mental health screening process. We strengthened the enrollment team to have with more resources and training for the team responsible. We had some conversations with patients who mentioned how important it would be to see their response results. So we decided to add a new tab to the app displaying results from some measurements, so they can see the evolution through the time. Talking also with the patients, they say that the postpartum questionnaire was available almost when the baby was born. So it was too early for them because they need some time for the recovery and to adjust their lives to the new person who was coming to the family. So we thought that delaying it 2-3 days was the best for them. We want also to talk about the challenges we faced with the project, and we want to give another point of view. The first two main challenges that we faced was the cultural resistance to change, because sometimes we do the things in one way, and to do self-reflection and to change the way we are working is difficult. So we try to hold regular informational sessions to the people from the hospital and other clinicians about the project. The second one was the misconception of PROMs. Sometimes they think that they are just surveys, but they are validated scientific tools that measure the outcomes, not only the experience. And one thing that has helped us is the rapidly growing field that are the PROMs. Some challenges that we are facing now is integrating the PROMs on the clinical activity and coordinating the multidisciplinary teams, because sometimes this seems to be more work. So giving feedback and real data of unmet needs help us to integrate this information or these PROMs into the normally workflows. And also the time constraints and workload are a main problem, but we have a strong institutional support, so this is a crucial factor to fight. So what has been the impact on maternity care? We are shifting from process-based to outcome-based care. We use the data to support new resources and care improvements. We are increasing our patient-centered approach. We give visibility to previously unmet and unmeasured patient needs. We have a more holistic understanding of the maternity care, and this has an impact on patients, professionals, and organizations. So which one are the lessons we have learned? One is that the patient-reported data reveals what clinical data cannot. That measuring outcomes change how we understand care. PROMs are not surveys, are a tool for transformation. The cultural challenge is the biggest challenge. The personalized care is no longer optional. And innovation in healthcare can be driven also by clinicians and patients. And what are our future directions? We are still growing and learning from what we have done, but we want to continue our patient inclusion and expansion. We want to create new care pathways tailored. We want to establish our PROMs as a reference. When we want to enhance patient enrollment and retention. We also want to expand the team, continue raising awareness of the project at conferences, workshops, webinars, give transparency and open data, and create spaces for dialogue and co-creation. And now I want to give the floor to Luisa. Thank you for being here. And she's going to share with us her experience as a patient that has participated on our PROM PARTOS project.
Well, hello, thank you for having me here. And yes, I prepared a slide. So, well, I participated in my first pregnancy and postpartum. And Andrea asked me if I wanted to participate, and I wanted to point out well, these 4 aspects. The first one, well, for me, was a very useful tool throughout my first pregnancy because I didn't know all the symptoms that they were related to pregnancy or postpartum. And with the PROM PARTOS, thanks to the questions that were written in the surveys, you could see that they were having the symptoms with the pregnancy. So the first aspect that I wanted to point out was the knowledge and relation of the symptoms of each trimester of pregnancy. Of course, all the women, when they get pregnant, they know that they will have fatigue or reflux. But for instance, I remember I had a really big wrist pain, and I didn't know that it could be related to the pregnancy, but with the survey from the 3rd trimester, I could see that there were a connection between the bloated and all the problem with the articulations. Also, another point for me was an effective communication with the hospital for preparing the labor plan. I didn't know what a labor plan was in my first pregnancy, and everybody was telling me, "Oh, that's so important, that's fundamental, you have to do it." And I remember when I started doing the survey from the third trimester, it was really useful because I could see that they were asking everything for preparing the labor plan. So that was really nice to have it, and I didn't have to present any document when I came here to give birth. Also, the support through the pregnancy and postpartum. I feel privileged because I have a big family network, and also my husband, but a lot of women, they don't. And in my postpartum, I didn't go through any problem. Well, I had a C-section, so that was a bit tricky, but I was feeling, I could feel the support from the hospital with the service. And also, the final aspect was a private space, because all these surveys, you can answer them through your device, in an atmosphere while you're at home, alone, in a private space. So for me, it was easier to open up and share my feelings about the pregnancy and postpartum. And also, I wanted to report that I have 2 kids. I participated during my first pregnancy, but I wasn't able to participate in the program during my second pregnancy because there was no record at the week 12. I reported to the hospital, and well, I couldn't participate, but they could solve a problem that they had with the PROM tracker.
Yeah, what Luisa helped us also, not only with the participation, it was like when the first women finished from their first pregnancy, the things that they wanted to participate again, and we at the first times weren't able to create another workflow for the second PROM partos. So that she says that to us, and that was very helpful because we were able to finish the first PROM partos for them to use the same user as this and the same ID with a second PROM partos, because at first this was a problem. We need to finish the first program to be able to start with the second one. So she helped us also with some issues with the integration of the informatic part. Okay, thank you for your attentions. Here you have my email and Luis' email also. Thank you very much for joining us today and giving us this space.
Thank you. Thank you so much, Dr. Andrea and Dr. Luis and Luisa, for that very interesting and wonderful presentation, and for sharing your insights with us. Before we begin the Q&A, I would just like to remind everyone that they can ask their questions by clicking on the Q&A button. If you did write a question in the chat, it might get lost. So it's best to just sort of click the Q&A button and pop it in there so we can try and keep track of them all. Yes, okay, perfect. So we can go ahead, and while those questions continue to roll in, we do have the first question here from the audience. How do you measure engagement rate?
The engagement rate, we measure it by, well, I will try to explain it. We measure from the very beginning how many women are completing the questionnaires since the anterior questionnaire, since the previous questionnaire. So that's the engagement.
Okay, I see. Thank you. We have another question on costs, asking about the impact you had on, what was the impact you had on cost?
Well, Well, we design and develop the app tool our service, because when we began in 2018 on the market, there weren't practically any tool with capacity to support our model. So we decided design and develop with a big help with a company, public technological company from government of Balearic Island. Of the cost was a cost repercuted in hospital and this company.
Brilliant, thank you. We have quite a few questions on patient feedback and participation rates. The first question is, based on your experience, what is the average time taken by patients to complete a survey?
The average time, do you mean the time it takes them to fill in the questionnaires?
Maybe this might be a good question for Luisa, actually, since she filled in the questionnaires. Did you feel like the questions were tiresome, or did you think that the questionnaires were quite long and took too long to fill out?
I don't really remember, so I guess it wouldn't take that long. I remember that every time that I had the survey to complete, there was a pop-up in my device, so it was really easy to get in, and don't remember how many. I remember that for me the longest one was the one that included the birth plan, because I'm not I'm not a specialist, so some of the questions were related to medical things that I didn't know, and I had to talk to my husband and check. Oh, so what does it say here related to the eyes from the newborn, blah blah. But no, I don't remember that they were really long.
So you thought that they were an okay length then?
Yeah,
okay, that's really good.
Yasmine, the app allow you until 7 days, I think, until 7 days to finish each questionnaire. Because in some pathologies, no child, there are a lot of items in some questionnaire, 100, 120, and allow you until 7 days to finish the questionnaire.
Okay, all right, thank you. We have maybe a more technical question here from the audience. Did you stratify patients into groups with different levels of risk?
With different levels of? Risk. No, because we attend deliveries from low, medium, and high risk. We are the referral center, so we have a lot of patients with high risk pregnancies, and they participate also. Yeah. We don't do we don't distinguish, because we think that they need also to participate, all of them, although low, medium, or high risk. Yeah.
Wonderful, that's excellent news. There is another question here. This is part of the same question as before. It's just an extension. I've split it into two. Can you please share the purpose of data analysis that you use to make clinical intervention, or is it to improve outcome at clinical level or to influence health policy?
Well, the platform with the aggregated information is shared by clinicians and managers, both. The indicator is open to check every clinician of the hospital and the managers of the hospital. Clinicians use to care, managers use to learn.
Thank you. Another question about patients. Are patients assigned to one member of the enrollment team for continuity?
Well, no, they are they are all in the no, only to one person, to me. Yeah.
Okay. Yeah. All right. A question here sort of on Okay, so are the outcomes measured in the ICHOM standard being used in any way for marketing purposes to help patients choose the hospital for maternity care?
Not at this point.
Not at this point.
No.
Let's see, what else do we have? We have quite a few questions on the tools used. I will mention really quickly, though, that the tools used can be found on the ICHOM website, but I will go ahead and let Dr. Andrea and Dr. Louise answer that. What are the tools that are used for the surveys?
For the
surveys?
The surveys that you provide to the patients, what are they?
Well, the app is integrated. I have full integration with the EHR. Only use two tools. One, the EHR, the clinician enroll the patient into the same EHR, and the second tool is the app for the patients, and the patient responds to questionnaires in the app. And after that, the information reported by the patient is integrated structured way in the EHR. I like insist, and our clinicians don't have to change any tool to enroll, to work, clinician work, and to check the information reported by the patient only in the EHR. This was one of our most important fundamental when defining our model.
And the PROM tools that you use for the pregnancy and childbirth set, what are those ones?
We use the same scales as the pregnancy and childbirth ICHOM set. We use the same. Yeah.
Yes. Sorry. The question wants to know the name of them. I will just direct them to the
sorry.
ICHOM website to find them out. That's absolutely fine. We have another great question here. How do you encourage patient participation? Do you provide some kind of small token?
Yeah, we do the reminder course that has been very useful, and talking with them, we created another slide on the app for them to see how they evolutionate on some items. We have chosen the ones that can be seen on every timeline, like physical health by the promise, the mental health, the bond between mother and child, and we have put it like a graphic and with faces, happy faces and happy faces. Okay, so
lovely.
Yeah, I think that this encourages them to continue with the questionnaires, and also the reminder calls are important. And when we explain the participation of the project, now we have the referral pathway to the mental health team. So this is an important tool also, and they also want to participate because of the screening of the mental health. Because by now 75 patients have been checked.
Amazing. You did touch a bit just now and during your presentation a bit on the ways you have tried to enhance patient participation rates. Yeah. What do you think has the most impact on increasing participation rates?
Well, I'm not sure, but maybe.
Yeah, I think it depends on the clinician. For me, it's very important a down-top approach. In fact, 3-4 failures we've had have been due to an approach top-down. No? For me, as manager, it's very important the cultural change of clinician. The power of this program and the future of this program is in the clinician.
Yes. I actually have a question here for Luisa as well now. So, Luisa, did you feel heard during your care, and do you feel that the questions in the surveys were important to you?
Yes, yes, I feel her. Actually, I remember in my postpartum, I didn't answer the first survey. And so they called me from the hospital and they asked me how I was doing, if everything was okay. And they encouraged me to finish the survey. So yeah, I feel.
And you felt it was worth it to fill out the surveys?
Yes, yes.
Okay, that's really good to hear. Another question here. Wow, we have loads of questions. So a question here, what is the size of the team that is working on patient support?
What is that?
So this will be, for example, engaging the patients in the project, helping them, if required, in using the app, helping them use the app. What's the size of your team working on patient support?
Yeah, 3 people, 2 nurses, and an administrative with the objective no lose patients. Okay, we pay personalized attention to avoid to lose patients with 3 people for all the program, all the PROM program.
Great. Let's see what's next. I was trying to pick a good one. Okay, so the next one is you mentioned that the data collected from the app is uploaded to the dashboard in real time. Is the analysis also done in real time?
Analysis.
No, the data is incorporated to the EHR in real time, 5-10 minutes. Is from information reported by the patient from app to EHR, and that from EHR to the data analysis 1 day is every day with its aggregated information. 5-10 minutes between patient to EHR, 24 hours from to EHR platform analysis data.
Okay, wonderful. Okay, another question, sorry. Are PROMs in your program used more for quality improvement purposes or more for individual monitoring of the patients?
Sorry, can you repeat?
Yeah.
Are PROMs used more for patient monitoring or for improvement of outcomes?
Depends on the clinician. You can find a group of clinicians who only use the PROM program to access to aggregated information in the platform, in the indicator, etc. But you can find too another kind of clinician that use the information, the EHR in medical consultation, before and after medical consultation. It's very heterogeneous.
Okay, I see. Another question here, sort of more general. Have you noticed a difference in patient engagement since the implementation of PROMs?
Since the implementation of PROMs?
I think it depends on not the time, but the type of the pathology. It's different. For example, the response old people with chronic pathologies than young people like Luisa with no chronic pathologies. The profile, the profile, the answer is absolutely different.
And the time of the ICHOM set for us, for being like 12 months, it must be easier to have more engagement or more participation. It depends on the pathology, as Luis says. It's not the same pregnancy and childbirth that is a process, and it's a natural process, the pregnancy, than a cancer or an illness, or an important illness, or a long timeline.
Definitely, thank you. Another question here, might be a bit of a difficult one. Can you share examples of actions that helped change perceptions of PROMs sort of to clinicians as valuable clinical tools?
Yeah, what helped us PROMs is to have the data, to say, we have a problem here. These are all the patients we have. What are we going to do with it? And at first, people didn't see how far we were going to go. But now I think that they have seen that with this type of tools, you can reach to improve or to create new clinical pathways. We have done a mental pathway to the women who need it. Now we are trying to create more tools for the incontinence, and another results that we are now trying to develop.
Thank you, Andrea. Another question here, how frequently do you follow the patient and how many times in the duration of their care?
Yeah, this is one of the main points. That's why our engagement, I think, is good, because we don't follow the patients. We don't see them on our physically. For me to say, we are not following them. We give them the app, we give them the timeline, we do the reminder calls, but we don't see them at the consultant. They go to the midwife, they know the annual program, and they can have some support. And sometimes in the second or third trimester screening that we do on the ultrasounds, we try to remember them. They are going to be they are going to receive more questionnaires, but we don't do an active follow-up with them, like in a consult. Okay. And I think that this is a very big point in our project.
Yes, definitely. Thank you for that. Another question through is, how do you follow up on the patient's feedback? And is there any specific personnel that monitor this?
Yeah.
The app, I think Dr. Alegre has said before, the app show the patient some graphic with evolution about some items reported by the patient. But we have program meetings with patients and taking part of the PROMs to share with them as clinicians, patients, and managers the results of the program.
Thank you. Let's see. So those patients with positive findings, like the depression findings, you do the referral, then do you follow them up after until the patient feels completely better?
Normally, when they enter in the mental referral pathway that we have created, we create a clinical entry that they need to be followed by the mental health group, and they will be called for a session, and they will be followed until they need. Some women need 2-3 sessions, some of them need more support, or until they feel fine. There is no deadline until they feel completely well.
Wonderful. More questions based on the results of the questionnaires. did you decide to add more educational materials available for patients and families?
We are in this we are in this main point now. We have implemented the mental perinatal health pathway, and now we are going to create this type of flyers, information by the app or by the device. We are working on it now.
That's brilliant news. Another question, have you included primary care teams in this project? Can healthcare professionals like GPs or nurses from primary care access the PROMs results from the data from the patients?
In two stages. Firstly, we have opened the analyze platform to clinicians of primary care, and we want. I think I explained in some slide. Our National Health Service is trying to share the information reported by the patient. Is located in our ICHOM with a platform for access for all clinicians and the rest of the hospital at the primary care center.
Thank you. What role does AI play? And Luisa, I was wondering if you were using AI during your care and how it helped with the consultation room.
So sorry, could you repeat the question?
Does AI play a role in data collection? And if so, what kind of role does AI play in this system?
Yeah.
I didn't check anything through artificial intelligence, you mean, right?
Sorry?
Through.
Can you repeat?
So it's sort of two parts. The first part is, do you use AI in this process for data collection and analysis? And if so, through the data collection, if Luisa did have AI through the data collection, did she find that this was helpful?
Okay. I didn't use it, but because it was 2022 when I got pregnant, and I didn't know about IA, but no, I didn't check it.
Thank you, Luisa. Another question to Luisa. What was the initial motivation behind completing the questionnaires, and any advice to those who are listening to us today, like you, who get questionnaires? Sort of, what advice would you have for them?
Well, before we started the webinar, I was telling them that the first time I came here to the hospital to say that I was pregnant and to notice everything, they told me to do a survey, and I thought it was just a survey to help health system, not to help me. But when I did the first survey, I realized that all the questions were related, like I had to rethink and do an introspection activity to check that everything was all right with me. So then I found that was key for me for my pregnancy, and also with the third trimester, and all the questions during the postpartum was also focused on myself. I mean, everyone is like, or your family, and you have a big responsibility, like taking care of a newborn, but sometimes everyone forgets the mother. So it was nice to answer that survey, because from the first survey I realized that was for me and not for them or for anyone.
Oh, that's lovely. You're absolutely right. Especially in pregnancy care, everyone cares about the baby, and sometimes you get a little less attention. So definitely important to make sure that you are being cared for and that you're getting the attention that you need, and it's not just the little baby. Another question here for Dr. Andrea or Dr. Louise. But please, could you provide a breakdown of your implementation team, specifically the department, the roles, and the number of staff members in each department, if you can.
Yeah.
Okay.
The structure for the program in the hospital is based in a clinician, a leader clinician in each pathology. Okay. And after that, we have 3 people, I said before. 2 of them are nurses with have calls continually to patients. Patient don't have answer the questions before 7 days. And we have them, some specialized in data, engineer and analysis of data, but it's our personnel share with another functions of the hospitals. And in case we are the person of the manager direction to facilitate the program.
Thank you. And how do the different teams that you just mentioned, the different personnel, how do they work together on the project? Do you maybe have like monthly meetings, weekly meetings, or daily interactions?
No, the three nurses is dedicated full completely to the program. Okay, with the leader clinician of each pathology, we have 1 meeting monthly or less, and the people in relation with analysis data is working daily. We have not all the programs, not all the pathologies have developed the analysis data, and currently we have working a lot in that.
Thank you so much for that. We do have another question. Did you find any barriers in terms of acting on the alerts, such as clinicians not knowing what to do or liability issues?
Well, when we put alerts, the alerts are defined with clinician to avoid unnecessary noise. Okay, and after that, each alert have defined with what action which people have to do. Okay.
Okay, and I think we will do a few more questions. So here, did you have any pre-implementation hypotheses of what to improve in the process that you wanted to validate or prioritize based on the results of the PROMs or PREMs?
In the case of pregnancy and childbirth, no, because now what I have seen is that almost in Spain we are the only group that is implementing pregnancy and childbirth. So for us, our experience is the first one. So we are learning from the things that we do okay, and learning more from the things we are not doing well, from the success and from the failures. So from our experience now, we haven't had any so much inputs to or someone to look for.
Okay. Are all of the team working full-time in this initiative? And do you need to share them with other departments, or do you need to share them with any other departments? Sorry, that was a but yeah, I'll ask again. Are all of the team working full-time in this initiative?
No.
So are team members all on this initiative, or are they also working on other projects, or are they all for the PROM PARTOS project, I think is what they're trying to ask.
No, the leader clinician now have assistant activity, care activity, but the 3 nurses is manage the patients. Yes, it's complete time.
Thank you. And another question here about the partners of the pregnant women. Did partners or caregivers of the pregnant women have to fill in any of the questionnaires?
No. Mm-mm.
They were all from the pregnant, the lady, the woman themselves. Okay. I'm just going to see if there's any other questions coming through, because I think we're reaching the end of the questions now. There's quite a few. There is a question now for the doctor's perspective. How did the PROM incorporation influence the case?
So do you mean how the incorporation of the PROMs have changed how we developed the care?
I think so, yes.
Well, a lot, because as I have said previously, you can know that you have some women that are struggling with mental health issues, for example, or with incontinence or with other type of issues. But if you don't have the numbers, you cannot ask for the interventions. So this is changing the way we deliver care, and we are more aware of what women really needs. So I think that's what it's the same as Luis has said before, that the cultural change is the biggest challenge. You need to change the mind from the people who is delivering the care. That this is the most important for the women, so we need to try to integrate it into our clinical workflows. And sometimes it's difficult because of the workloads. I work on the PROM program, on the PROM Partos program, but I also have my normal practice, so sometimes it's a bit difficult and struggling, but and also it's important the engagement of the team for the project to continue and to grow also.
Thank you. Absolutely. We'll do 2 more questions now. The question I have is, did you notice any sort of bias when doing patient-reported outcomes, such as social desirability bias or recall bias?
No.
No, but
For me.
I think we need more time with the PROM program consolidated at the hospital, with maybe a number of patients increase, but I don't know if we have some bias due to.
Thank you. A last question to Luisa. What advice would you give to clinicians as to how best to hear their patients and ensure that outcomes that matter most are being used in a meaningful way?
Could you repeat, please?
Absolutely. Sorry, it's quite a mouthful, this one. What advice would you give to clinicians as to how best to hear their patients and ensure that outcomes that matter most to patients are used in a meaningful way?
I think the most important, well, for me as a patient, was to feel close to the clinicians. Like, well, I have a baby at home. He's 6 months old, and in this last birth, I was feeling so close to midwife and to the nurses, and that was really, really, really nice. When I cried, when I had my baby on me, they were also crying, and they were also saying like congratulations, and they were having me. And I felt really close to them and also really respected, because they were asking me all the time how I was feeling, and I think that's really, really important to take care. Well, due to pregnant women, not only thinking about the baby, but also thinking about the women that are going through this process.
No, absolutely. That makes a lot of sense. Thank you for that. I think the relationship between doctor and patient is very important. Absolutely. So thank you for that. And our last question to Dr. Luisa, Dr. Luis and Dr. Andrea is, what advice would you give to other organizations who are looking to implement the pregnancy and childbirth set?
A good question.
Yeah.
I don't know. For me, it's very difficult to give an advice. No, I think each organization is different, but I think it's necessary clinical usefulness. I think it's necessary digital integration properly in design, and I think it's necessary an attitude different with the patients.
And for me, one of the important things that I didn't knew at first, because when we started the project, but Luis had it very, very clearly, was the integration of the informatic part. Because if this works, everything will come, because you will be able to see all the information almost in real time, and it will be easy for you to see it. Also, the engagement of the team, because you need to have a team that must be compromised for the project to continue, for the developing, and also having patients like Luisa. Yeah, no, it's you.
Lovely.
Yeah, this helped us to self-reflect also, and I think it's good also for the clinicians to see a different part and to know that you are not, what you are doing is not the same as the patient is living, and it's fine, and it's also their point of view, and you need to do this self-reflection to go down, to have a low profile, and to also learn from them. So I think that I will tell them to start also measure, because when you measure, you will know what you are doing.
Absolutely. Thank you for those very important lessons and insights into where to start. Thank you so much for your time today, Dr. Andrea, Dr. Luis, and Luisa, and for sharing the wonderful work that you're doing at San Espases University Hospital. Before we officially close today's webinar, I'd like to bring your attention to the liver disease patient validation survey. Please share this QR code with anyone who may be living with liver disease. We invite them to take the survey to help confirm which outcomes truly matter most to patients. They will be asked to review the proposed outcomes and share what's most important to them to shape the final ICHOM set for liver disease. To access this survey, you can scan the QR code here, and the survey is open to participants living with liver disease in the UK, US, and New Zealand. And finally, our next webinar is on the 5th of May with the Peterson Health Technology Institute. They will be treating us to a discussion on ensuring digital health performance-based contracts are optimized for patient outcomes. So please do scan the code to register for that webinar as well. And that brings us to a close here today. Thank you again to our wonderful speakers, and thank you all for joining this webinar. We hope to see you again in May. Thank you.
Thank you very much.
Good evening. Bye-bye.
Thank you.
Thank you.
Bye.
Bye.
Thank you.